Last week on Saturday, police had an operation where it arrested 31 people for violating presidential directives and guidelines on fighting Ebola. 24 of them were arrested from Homeland Bar and Restaurant, but it later turned out that 13 of them were health workers attached to Uganda Red Cross Society and part of the burial team for Ebola victims. Speaking out on the incident today, Irene Nakasita, the spokesperson of Uganda Red Cross Society, refuted the claims of any law-breaking, revealing that their volunteers follow a strict code of conduct in tandem with the Ebola prevention guidelines.
We continue to work with the communities and the stakeholders within Mubende to ensure that we continue with the fight. Because first of all, we are custodians of the guidelines, and it is within our means and mandate to protect the guidelines and respect them.
According to Irene Nakasita, the volunteers have since been set free. However, the police insist that they will prosecute the violators of the law.
People who deal with patients. Now, they are the same people who are going out partying, dancing up to 11 p.m.
The team had just returned from a burial, and they have a speaker that plays some music, and for us we believe this is part of how they shed off stress, psychosocial support, because looking at the nature of the work that they do requires them to have that moment of PSS that is food for their soul in a way.
On the other hand, the Ministry of Health is set to organize the 4th annual Uganda-UK Health Alliances Symposium along with their partners. Speaking on the matter, the Director General of Health Services, Dr. Henry Mwebesa, revealed that the event will help showcase what is being done to improve the health sector.
We improve equitable access to modern interventions and fast-track global development goals on the health sector.
UK is the second largest donor in the health sector, and over the last 5 years the UK government has invested something like over £1 billion, that's 5 trillion shillings, in Uganda, and a significant amount of which has been allocated to health, covering HIV/AIDS, covering tuberculosis, malaria, maternal and child health, and health security.
The symposium comes at a time when Uganda is grappling with an Ebola outbreak of the Sudan strain, which has claimed the life of at least 37 people.